Thank you so much, Melody, and welcome everybody. I'm in fact no longer on the board
Oh,
because I'm too busy with other stuff, but I am a volunteer with Sunshine Coast Hospice, so I provide palliative and end-of-life companionship. And I very much coordinated the creation of and I manage the Sunshine Coast Greensleeve program. I'm also working on the construction of a new hospice here on the Sunshine Coast. I'm one of three, um, really two volunteers who are actively participating in the build itself. And then, of course, there are many, many people contributing to the creation of that, which is a partnership with VCH. But the Greensleeve is really my baby, so I'm really happy to be able to talk to you all about it today. And I'm coming to you from the ancestral unceded homelands of the Shishal and the Squamish nations. And this is a place, as Melody said, where waters meet. And for millennia, people have gathered at places like this, where waters meet and communities can gather to tell stories and share resources. And that's really what I hope that we can do today. And as Melody said, we are a semi-rural community of about 35,000 people along an 85-kilometer long ribbon of highway from the Langdale Ferry to the south, coming from North Vancouver or West Vancouver, up to Egmont and Earls Cove to the northwest that would lead you to Powell River. So we're technically mainland, but we're surrounded by water on three sides and mountains on another. So we are very much kind of our slogan is not an island, but we are very much an island style community, if you like.
hmm.
Um, yeah, so next slide, please, Esther. I think before we begin, I did want to ask you if you have specific questions or information you hope that I'm going to cover today. I invite you to throw it into the chat. And in fact, as I'm talking, if questions come up, just throw it in there. And if I can see it and navigate it while I'm talking and incorporate an answer into my presentation, I will. But it also gives us some talking points right away when we do hit that Q&A portion. So please do give me your questions. So yeah, this slide, I had to really think. I mean, I was invited to make this presentation, but I had to really think, what am I hoping we'll get out of this? So if you could click once, Esther, so we can see the first goal was to understand the benefits and challenges of a community-driven program like our our Greensleeve program. And there are real benefits and challenges, and so I hope that I can convey that to you. I also hope that my second objective is that we can share ways with each other to encourage more advanced care planning in our communities. And sometimes I feel like we're all trying to reinvent the same wheel in our little pockets, our little areas. So I hope we get lots of new ideas out of today. And if you can click again to number 3, Esther, identify community partners to collaborate with, because what we've realized as we've gone along is that we're starting, we are continually actually identifying people in the community or organizations in the community, roles in the community who can help encourage our program. So if you can go on to the next slide, Esther, that would be good. I guess maybe I'm not seeing what you have, so hang on a sec. I got to move things around a little bit. Right. So let me quickly just introduce you to the Greensleeve. Hang on a second. I've just lost my notes. This is what it looks like. It fits folded 8.5 by 11 sheets, and it contains, it's got magnets on the back. The flap is Velcroed shut. It goes on or near the fridge, so hence the magnets. It's got an emergency information form, and the idea of that form is that it provides first responders and those first healthcare workers, the healthcare providers who are seeing these patients. It provides them with immediate information that it might otherwise take a while to gather. There's also a temporary substitute decision maker form. And I will say this is more an exercise that we want people to go through, is to think about who in a situation where they haven't got a designated decision maker, they kind of work their way through this legal hierarchy of people that would be asked to make substitute temporary decisions around their care. And very quickly in our workshops, as people start to go through this list, they realize that some people would be much better at it than other people. So our goal is always to get people really thinking about designating their own decision maker. There's also the two green dots you see at the bottom in the center, and those are visual cues for the first responders to tell them that there's a green sleeve in the house. So one dot would go by the front door in some easily visible point so that they can say to themselves, oh, there's green sleeves in this house. Great. One of us needs to run to the fridge. And then when they get to the fridge, if the green sleeve isn't readily apparent on the fridge, they're going to look for the other green dot that might be on the cupboard above or in a corner at the top. So they'd reach to the top of the fridge or maybe in a drawer beside, but it's somewhere around the refrigerator. And finally, there's a 23-page booklet that we created that covers a lot of what we talk about in our public workshops, but it also gives people a lot of resources and links to additional information. So next slide. This was actually a COVID project. So in the beginning, before COVID hit, as an organization, and I think for those of you who are coming from hospice community organizations, you're likely doing advanced care planning workshops in your community. We were doing that. We were doing 2 or 3 a year because we have sort of 3 groups in our community or 3 areas, town areas in our community. And then COVID hit, and suddenly we couldn't do those in-person workshops anymore. And we decided to do a workshop titled Advanced Care Planning in the Time of COVID. And it was a Zoom live feed Facebook workshop, which none of us had ever done before. So I think we can all remember back to those early days of COVID when we were scrambling to figure out how this digital communication world worked. But our speakers were Dr. Carmen Guja, who's a family and palliative physician on the coast. She was the medical interpreter of what COVID meant to us in terms of our what we may face. And the other was a volunteer, Joan Hibbard, who was a retired nurse educator and who had been for years doing those ACP workshops. And then I was the coordinator techie person. And so at that time, what were we facing? You know, when COVID hit, I think for the first time, it really hit a lot of us that we were, you know, life could be fragile and we were mortal. So there was certainly that impetus to understand what we might be facing. And as we were planning the workshop, Dr. Guja had noted that in her role as a palliative physician, less than a third of palliative patients on the coast, and those are people who are designated palliative, as in living with an illness that they will likely die of within the year and under the care of the palliative home care team, less than a third of them had goals of care in place. And physicians were using very inconsistent goals of care that ranged from a mix of free text to one of 2 official forms, the provincial form in BC, the DNR or no CPR form, and then the health authorities forms called the MOST, the medical orders for scope of treatment. So it was very inconsistent. And then we started looking for collaborators, like who else is interested. So there was a community paramedic working in the Northwest, of our area, the Madeira Park community paramedic at the time, she was trying to develop something for her community that she was serving, which is actually a very rural community, lots of little roads down to lakes and the ocean, and a lot of older people living quite isolated in that community, in that area. So she was trying to do something. And we said, well, why don't we work together? So we, sort of identified as our goals that we wanted to get a green sleeve program going like they had in Fraser Health or Alberta Health. And we wanted to increase the goals of care conversations that were happening for those people living with palliative and chronic illness. And Dr. Guja and Vancouver Coastal Health, the health authorities were trying to move to a more consistent use of goals of care. So next slide. By the end of the pilot project, which was 2 years, it took us about a year to kind of really figure out what we wanted to do and what we felt our community needed. But at the end of that time, we did have 700 green sleeves in the community to most of those people who were living with either chronic illness or life-limiting illness, those people who were especially vulnerable to the COVID virus. We had conducted 42 in-services at least, and workshops, and that was partially to the general public, but almost half of those were healthcare professionals and first responders. And Dr. Guja with the healthcare professionals had done a lot of work to facilitate in-services, to introduce the green sleeve concept, to provide training around serious illness conversations and goals of care conversations, and to review and really reinforce the advantages of using the MOST form over the no CPR form. The MOST form just provides a lot more information around interventions. And she also conducted metrics at the beginning of the project and then at the end of, by June 2022, as our pilot project wrapped up. And she noted that physician confidence in having goals of care conversations had gone from 60% confident to 100% confident. And they were having significantly more goals of care conversations with their patients in their practice. And so that was a big win. And finally, use of the MOST form for the palliative patient cohort had increased by 80%. So it was great. We really felt we'd accomplished a lot. And next slide, please. At that point, our pilot project wrapped up. Oh, and I should take a step back actually, because this was really a collaboration. By the time we were really in the thick of it, we had Dr. Guja and the Division of Family Practice. The Division of Family Practice brought in funding from Shared Care to help us with it. And hospice and Shared Care split the funding for that pilot project. We had BC Emergency Health Services through the community paramedic. We had home care nurses from the Shisal Nation Home Health Unit. And through the division and Shared Care, we were invited to bring our project, our sounding board became monthly meetings with a Shared Care palliative care working group, Shared Care funded palliative care working group. And this involved more doctors, more the palliative care coordinators, social workers. So it really was a collaboration of people coming from many different perspectives. So it was really wonderful. It was really wonderful for us as an organization to be brought into that those medical conversations, that healthcare focused conversation. Anyway, when the pilot project wrapped up, we decided we would make it a core program of Sunshine Coast Hospice. So, we do palliative support to individuals and their families when they're experiencing a life-limiting illness. We do a lot of grief support, and we have our advanced care planning, which is a lot of public outreach, but it's also providing one-on-one support to people to complete their green sleeve and to establish an advanced care plan. So today we have over 5,500 kits out in the community. We've conducted more than 100 education workshops in presentations reaching well over 2,000 people, mostly in the community, but also in sort of provincial presentations like this one. And I guess we've got lots of resources on our website. Everything in our kit almost is available as a PDF on our website. And we've developed this core group of advanced care planning volunteers. And I think this is what sets our program apart from other more health authority-based Greensleeve programs, is that we have a core group of volunteers who can provide one-on-one support to community members who are struggling to complete their Greensleeve. So in the last couple of years, those volunteers have provided, well, actually, no, I guess that number's kind of since inception, but we've only been doing it for the last couple of years. More than 325 hours of one-on-one support and many, many hours of program management, because the bulk of this program is done by volunteers. And we've really ramped up our public education sessions. So I think last year I did 23 presentations. It was a really big year. We got some great funding from the Notary Foundation of BC. And part of that was really to encourage public presentations and dialogue around advanced care planning. So next slide. Challenges. There have been many challenges. One of the things we wanted to do in the beginning was we really wanted to track metrics around kind of how the Greensleeve was used through the illness journey of a patient. So we had kind of all sorts of different forms to gather information through the paramedics and through the hospital. You know, did somebody arrive in the ER with their Greensleeve? What was included in it? Was the most reviewed? Was it updated? Was the updated version put back in? All that kind of stuff. Any of you who are working in a hospital setting are probably groaning right now, because there are so many procedures and policies and documentations that have to happen that you can imagine those forms really didn't get completed. So we weren't able to track the metrics in healthcare to the degree that we would have wanted to. Well, really, really not much at all, to be honest. And I'd say our biggest challenge since we finished the pilot project is gradually over time, it's been really difficult to keep our partners informed. Partly because of our own limited resources, but also so many changes in healthcare, a shortage of doctors and nurses, a lot of attrition, a lot of people coming in on contract or sort of term limited commitments. So a lot of continuity of care is lost. We have a lot of unattached patients who don't have family physicians. I think approximately 30% on the coast, although if anybody's coming in here from VCH, they might have a more relevant number. And so a lot of them don't have GPs with whom to discuss their goals of care if that's where they're at. And this is a community-led, volunteer-driven program. We also have limited resources. There's a lot of demand for our services because we're filling a lot of gaps in palliative support and grief support. So we are stretched very thin. And there's no sustainable funding for this program. We have, every year or two, we go out and hunt for funds, and we get a little bit here and a little bit there. We were really, really lucky with the Notary Foundation of BC. They gave us enough to fund our kits for 2+ years, and that's been really great. And a year from now, we'll be looking for more funding again. And this is really, I keep saying it's an analog solution in a digital world because the systems don't necessarily talk to each other. So there's no central place officially to store goals of care documents. The doctor's offices don't currently talk to the local hospital systems. The paramedics have a different system also. There is a big impetus within VCH to consolidate to the Cerner system, but my understanding, for example, in the Lower Mainland, Fraser Health, for example, has a different system entirely. So, and because we're moving back and forth from Vancouver, which is our kind of specialist resource center, information can be lost. So we really encourage people to have their green sleeve with them when they're dealing with significant illness, and they're taking it to their appointments, and they're letting their specialists know what their wishes are, and they're looking to update their information all the time. And like one thing we realized even really before this, that partly led to the green sleeve, is that while the public is really motivated, we get really good uptakes on our workshops. We have usually 20 to 40 people attending when we offer a workshop. And people are really motivated when they go and they say, this is great, I'm going to do this. And then they go home and they think, oh, wow, this is really overwhelming. I can't remember everything. And this is really hard. I have to talk to my family. I've got to make a lot of decisions. I've got to really think about what's important to me. They get overwhelmed. So we realized very quickly people need support to complete. And finally, another challenge is those unattached patients. What do they do if they're living well into their late 80s? They don't have any significant health concerns per se, but they don't actually have a doctor who can sit down with them and have a goals of care conversation. So if we could go to the next slide. I don't know how many of you are familiar with this Gartner hype cycle, but it really resonated for me because, our innovation trigger was COVID. And we all got really on board, all of our healthcare providers and paramedics, everybody was very excited about this. And our public were really hungry for information. Like that live feed that was on Facebook for quite a time had like something like 630 views, and people were really hungry for information and data and solutions and stuff. And we launched and everything was looking really good, and all the doctors were on board, and everybody was pretty excited. And we achieved our pilot project, and then gradually over time my slope would be more gradually downward. We realized we really had to fight to keep those lines of communication open between our partners. And I think for me, the trough of disillusionment was quite recently when we received an email from a community member who he and his wife had completed their green sleeve, and they were very proactive. They'd really thought hard about it. They'd documented their wishes. They had talked to family. They'd done everything they were supposed to. And when they called the paramedic didn't know what to do with it. They didn't understand what it was. They didn't really want to look through it. They didn't have time. They weren't really interested in taking it along with the patient, but the spouse did, and then in the hospital presented it to the healthcare workers, who said, wow, this is amazing. You've done lots of work. What is this thing? And that kind of broke my heart in that moment. But sometimes I feel like we're the little red engine that could, I think I can. So now we are working on reopening those communications and trying to get a more routinized or scheduled or systematized way of making sure that incoming doctors, contract physicians, contract nurses, how it can be part of their onboarding process, and similarly with the paramedics. So that's definitely been a challenge. But what hasn't been a disillusionment or a challenge really has been keeping the public motivated. As I said, they turn up regularly for our workshops, and they ask questions, they call for support. Yeah, I have 350 people on a workshop email list, and people generally open those emails. There's always a rush of people signing up when I send out an email saying we've got this workshop coming up. So, in terms of public exposure, this is working really well. Um, and we're always looking for, I can't see it very well, but the slope of enlightenment, like how can we expand our reach? So one of the conversations that's happening now is how can this work for staff in mental health and addictions for that underserviced community? How can we make that work? How can we support those healthcare providers in in using the Green Sleeve as a relevant document for that community? How can unattached patients have a goals of care conversation? And that one we found um, a very good solution through the Division of Family Practice, where we can our client services person can take some referral information and send it to the Division of Family Practice. And the coordinator there has a couple of physicians who've agreed to have those goals of care conversations with unattached patients. And more recently, well, and having the advanced care planning volunteers who can provide that one-on-one support is another way that we're improving our delivery. And recently, we've decided to expand our workshop presentation into 2 sessions. And the first session is a general introduction to the concepts of advanced care planning and a couple of exercises and some homework. And then a week later, they come back with their green sleeve, with pen, paper, identification, their representation agreement, which in other provinces might be referred to as a power of attorney for personal care. But it's the legal document where you select your decision maker. So we're always looking for ways of improvement, and and so that we can achieve a sustainable plateau of productivity. So, next slide, please. What are the key takeaways? This program works best when we're working in collaboration with healthcare's first responders, allied professionals. And if this doesn't work for those people, it's not really going to work for the patient either. So we really need those collaborations to be, those relationships to be robust. And so we have some work to do there with both healthcare and first responders. And we're always looking for ways of increasing the collaborations. So in the last couple of years, we've had 2 of the law offices in SCHS take on the green sleeve as part of when they're doing planning documents. So wills, powers of attorney, representation agreements. For clients, they say, hey, do you know about this? Why don't you take a green sleeve? Let's put your representation document in here, and feel free to call hospice and find out when they're conducting workshops, or if you want somebody to come and walk you through it, etc. Pharmacists, we haven't is a really strong untapped resource, because pharmacists in a community like ours, they really know people. People can be very loyal to their pharmacists, and the pharmacists understand the healthcare conditions that they're living with. So there's work to be done there. Financial advisors is another sort of goal partner. And I think that a program like this needs a champion, and in the community, it needs champions. So initially we had Dr. Guja as our champion in healthcare. We had the community paramedic as the champion for the first responders. And I've certainly been the champion for the community for hospice. But I think without those champions, or that champion, it is really hard to keep the momentum going. Funding is always a challenge. There's no sustainable funding. It would be great if there were funding through the Ministry of Health for advanced care planning. There's always more to be done. I've sort of talked about that. And advanced care planning should happen earlier. So if you can go to the next slide, Esther. You can see this is a wonderful infographic from Interior Health. And I think the Center for Palliative Care originally helped work on this. But the other Greensleeve programs that are really well established are Alberta Health and Fraser Health. They've both had Greensleeve programs for a long time. And they come in at the point that someone has been diagnosed with a serious life-limiting illness. This is where for the health authorities, the conversation around advanced care planning comes in. But I think organizations like ours and the BC Centre for Palliative Care would say advanced care planning should happen much before that, when people are well and they can put some thought into what is important to them, who they want making their decisions, etc. I think for those of us who, in our own experiences as caregivers, have had to look after somebody who didn't really plan ahead, I think those people are really well motivated to put some kind of plan in place. And I know that for healthcare providers, they really want to see people who are living with those chronic and serious illnesses, palliative illnesses, and who may be frail elderly, say people over 80 should have an advanced care plan. But often by then it can be kind of too late and too difficult, and it's really important to start those conversations early. So on the next slide, Esther, I want to open this up a bit and ask you what you think is, what are the benefits where you're coming from? If you're a healthcare provider, like what do you think the benefits are for healthcare providers with something like this? You can throw it in or just popcorn in, unmute your mics and jump in, or throw it in the chat. I mean, I would say for healthcare providers, the Greensleeve gives them a way to invite conversations with their patients around goals of care. It gives them something really tangible. And it benefits healthcare providers if their patients are informed and ready for that conversation. So the work that we do in community should serve healthcare providers. And I think it's really important that it results in a clear roadmap for what the patient wants in terms of interventions. And that roadmap helps healthcare providers helps families to navigate what that person's wishes are. So it's a clear legal roadmap in many cases. And it gives them information about the patient in a world where often there isn't that continuity of care. I mean, in our own community 20 years ago, the physicians in the emergency room were physicians in community, so they would know people. But now most of the ER docs are not family docs in clinics. They're emergency room physicians or hospitalists. So they don't have that community perspective. So it gives them information. Who is this person? What do they want? What's happening to them? Similarly for first responders, like I remember dropping off Greensleeve kits to one of the stations in about year 2, and the person who was in charge that day actually started to cry and said, "This is amazing. When there's goals of care, when there's a MOST or a DNR in this package, it's such a relief to us to know in a situation where CPR is not going to benefit this patient and is going to be extremely physically traumatic for that patient, it becomes emotionally traumatic for the family. And not just the family, but for the paramedic too, when they know it's hopeless and yet they have to do this rigorous physical invasion on a person's body." So I was very touched at that. I'd never really thought how traumatic it was for them as well. So it gives them clear permission not to do CPR. They can use that to say to the family, look, this was a conversation they had with their doctor, and we want to honor their wishes. So that's certainly positive. Um, what about for people? I notice you're all being very quiet in there. Um,
Well, I'm sure it benefits the families as well as
yeah,
the patient to have that. I mean, they can go in and advocate. I mean, the more everybody knows, with healthcare providers, they have the same issue that, in a way, first responders do, is about how much treatment is needed, and they've got clear guidelines about how far to go and when to stop, and it must help everybody, really.
yeah, yeah. Yeah, it really does. You know, and in our public presentations, we always say, if you do nothing else, talk to your family, so that it's, when the time comes, they can understand what you want and they can honor those without having their own emotional reluctance to make tough decisions. So it really encourages people to think ahead. The green sleeve for us, I think it gives people a template around which to work that can be quite useful. And we really try to empower people to take control of their future care and to initiate conversations both with their family and with healthcare providers. And if they need it, we can support them in navigating their own situation and completing their plan. For us as an organization, that invitation to become part of a healthcare conversation has been really rich for us. And I think it has really helped reinforce our relationship, for example, with the home care team who can refer people to us to support for palliative support or grief support after someone's died. So it's been really good. And I think the fact that we're building an 8-suite hospice in collaboration with VCH now that will open next year has really, I think that growing relationship has been really helpful. So that's really my presentation. I want to thank you for your attention. Certainly, there's lots of resources on our webpage, and I can be reached at acp@coasthospice.com if you have questions afterwards. So I would open this up to the floor and invite you to speak up. And I noticed one person said, are you aware of the Hope for the Best Plan for the Rest created by the Waiting Room Revolution? And absolutely we are. We had Xian Xiao actually come and do a presentation through our hospital foundation to talk to the general public. They had, I think, about 125 members of the public show up to hear him speak. And we have a group of volunteers who are working on a presentation to augment our green sleeve work in the community. So yeah, it is a great resource for those of you who haven't tuned into that. It's a podcast that's coming out of Alberta, and the first season especially really outlines sort of 7 steps to navigating the healthcare system in today's healthcare world. I highly recommend it. Any questions, comments, ideas?
I just
Sue?
want to say how really inspiring it is what you've done in the Sunshine Coast. I'm a
Oh,
hospice volunteer in Nanaimo on Vancouver Island, and I volunteer in the palliative care unit, so that's my end of things. But just starting to get involved, we set up a advanced care planning team. We've done a couple of workshops, but we're really early days. And
yeah.
we don't want to reinvent the wheel because there's so much good material. And my plan
Mhm.
for a while was to make contact with a number of hospices in BC and find
Yeah,
out what their programs are. So,
right.
I mean, I'm really, what's interesting to me is the whole team of volunteers you have to do one-on-one um, sort of support for people filling out their forms because I'm not that keen on the My Voice publication because I think people start it and just quit. I mean,
I call it the Encyclopedia of Advanced Care Planning. It's
yeah,
very, yeah,
yeah, and that's all that people have been given so far in our program, and I'm going, I don't really think this is very effective.
yeah.
I'm hesitant to do the one-on-one support, and I want to really push them on that. So I'd like to know more about, did you recruit volunteers specifically to do that role, or was it just generally from the pool of volunteers you asked who was interested?
When we do the training, we do a bunch of presentations to our oncoming volunteers about the different programs. And usually there's one or two people. Usually we're bringing on, kind of depending on time of year, and 12 to 18 new volunteers. And there's usually one or two who say, oh, this really resonates for me. Um, yeah. And sometimes, for palliative volunteers, it's sort of a segue into that palliative support. But it is, it's one of those resource things, because you really have to build your knowledge base around representation and um, goals of care. And we're not having goals of care conversations, but it does kind of come up, and it just helping people navigate yeah, there's a lot of information to learn. Um, I noticed Fran says, are there privacy considerations to be aware of when starting a Green Sleeve program? Were you required to complete a privacy impact assessment? I know privacy is an issue for all the work we do in hospice. We don't keep personal information. Well, if we are providing ACP support to someone, they onboard as one of our clients, and our information is secured in a program called Info Anywhere, that's held in Canada. It meets all the privacy requirements. Our volunteers know that any of the work that they do with clients is confidential. Um, so I'm not sure if that answers your question. Any other questions or ideas? Is there something that you're doing in your community that you feel is really working well? I noticed Robin is saying we have 20 registered for our ACP workshop coming up next week in Duncan, also offering it in September and October. That's Cowichan Hospice. Yeah, and we have similar demographics with Vancouver Island communities. So I think there is real interest in population. Our demographic is 50% of our community is over 50, and 38% of our community is 65 or older. And that's nudging up to a kind of a peak within the next 5-10 years. Where can we get green sleeves? I would say contact me. I'm not quite sure how much you're hoping for there, but you can contact me separately afterwards at that acp@coasthospice.com. Or if you can't find my connections, our website has a general portal for email inquiries. But feel free to contact me afterwards. I mean, our packages they're sort of branded for the Sunshine Coast, but the information is relevant no matter where you are. I will tell you that the kit with all the inserts and the bits and pieces, those third-party costs, the printing costs, are about $350 a kit. And that was based on our last run, which was the biggest run we've ever done, 4,000 units, and doesn't include staff and design time. And it doesn't include the volunteers it takes to have a work bee, to put the magnets on, to put everything together and put the magnets on and put the Velcro on. So it does take a lot of work. Any other questions or comments? Please, if you are looking at our materials, if you have any suggestions, any ideas, I'm happy to receive feedback. As I say, this is something, we're constantly striving to make it the best program that we can. So please feel free to give me your 2 cents.
I just think you've done an amazing job. I really do, that you've reached that many people and made that so many collaborative connections. I think it's really, really great.
Thank you. Thank you so much.
I'd like to copy you.
Well, you know what? This does bring up for me the point that we had a lot of support. Anybody we contacted when we were doing our research and trying to figure out what to do, Everybody was very helpful. Fraser Health, they were amazing. And the shout out to the BC Centre for Palliative Care. If you're trying to train volunteers, you don't have to reinvent that wheel. You can have them take the training through the center, the volunteer facilitator training. It's a really good program. All the concepts are really the same across this country, really anywhere. Some of the technicalities of it, what's a rep agreement in another province, vary, but it is a really good training. And we sort of customized ours because we have this template that we're working with. So, but the concepts don't change, and the training is good. Yeah, and I invite you to use our resources on the website. There's a bunch of other links, People's Law School for BC Legal Matters. They have really great infographics that you can get through the Queen's Press for free. I highly recommend them. NIDUS, also an amazing, and NIDUS is a legal resource focused on planning. It's a little less easy to navigate, but it's amazing. And I think they've been really improving their sort of website design to make it more accessible. So there are so many resources. We've put a bunch of the links up on our website, but there are more. If you have a great resource you think we should throw up there as something for people to look at, by all means, send it along.
Thank you, Jackie, once again. And I don't know if we are still waiting for anyone that has like any question.
Well, it looks like everybody's. Oh,
Okay. Thank you so much, everyone, for joining us today. For the most part, I just wanted to highlight our ACP culturally adapted modules on the Learning Hub. I'll be sending out the link as well as the ACP webpage and the resources for individuals about ACP and resources for community organizations. On behalf of the BC Center for Palliative Care, we hope you and your team may have capacity to consider an invitation to host an echo session to amplify National Advanced Care Planning Day today, and how care conversations are translated or not translated from patients to healthcare providers for various settings to end of life and hospice care. And on that note, I think I can just say thank you once again. A quick survey will pop up on your screen when you leave the session. We'll just appreciate you taking a moment to share your feedback, and we'll be sending out a summary of today's session in about a week's time. Thank you once again. Take care, everyone.
thank you so much for
Bye.
coming in. Have a great day.